Good morning, good afternoon, good evening, and good night, depending from where you're watching and listening to me around the globe. I have come again. I am Mbonu U.S. By vocation, I'm a Catholic priest. By profession, I am a licensed clinical psychologist. In my YouTube therapeutic series on conquering bad habits, today I want to talk about a silent killer, a mental illness that is called depression. How to deal with depression. So, what is depression? Depression is a state of low mood and aversion towards activities that you used to do or hobbies you like doing, but you cannot do them again because you have lost interest. The interest has been killed in you, and this affects the way you think, your emotions, and your feelings, and your general mental well-being. So, depression can be graded in 3 levels: mild depression, moderate depression, and acute or severe depression. It can be in short term and also it can be in long term. So, what are the symptoms or signs that you will find in yourself or in a loved one that show that you are really depressed? 1, acute sadness that is prolonged, and it can take weeks, even months in you. It's a sign or a symptom that you are depressed. Secondly, inactivity in you, withdrawal from the people, withdrawal from social activities, lack of interest in doing anything, lack of appetite or have increased appetite, difficulty even in thinking. You feel a sense of sadness in you that leads to rejection, dejection, and also abandonment. There is feeling of hopelessness and also emptiness in you. Then you're withdrawn from life because life is tasteless. You have low self-esteem, low self-image, low self-confidence about yourself. And the last symptom is suicidal tendency. So what are the causes of depression? To tell you the truth, there are no exact causes of depression, but there are factors that can lead to depression. 1 is hereditary factor. If your parents or your grandparents were depressed, you have a chance of being depressed in life. 2nd is chronic diseases or illnesses. Then the 3rd is maybe the environment that you find yourself or the work that you do. Negative stress that leads to distress and depression. Then mental health or mental illnesses that you undergo. When you have traumatic experiences, maybe the loss of a loved one, bereavement, or you are being attacked by armed robbers, or kidnapped, or sexual abuse, or any attempt towards your life. And you can have like a racial or gender disparity or segregation. This can lead to depression. You have also personality issues or sexual disorders, anxiety disorders, and other unknown causes or factors that lead to depression. So what are the effects of depression? There are 2 major effects of depression. 1, depressive disorders. So depression leads to depressive disorders, which are mental illnesses, and anxiety disorders. They are treated extensively and intensively in this book that is called Diagnostic Statistical Manual for Mental Disorders. So they are treated here. So This depressive disorder, just like major depressive disorders or the depressive disorder caused because of health issues or because of addictions, they are in this book. Then you have anxiety disorders, a panic attack, panic disorder, agoraphobia, what is called selective mutism. You have generalized anxiety disorders. There are many of them. So the question is depression treatable? The answer is yes. That's the good news about it. But before I talk about the treatment of depression, I want to talk about the diagnosis, the prognosis. So what is diagnosis? It's the Greek word that means seeing through, for you to identify a disease. So through this book, you can diagnose depressive disorders. So when you diagnose it, there's what is called differential diagnosis, which is a medical term, because there are some other disorders, mental disorders, that have the same symptoms, similar symptoms to depression. That's what is called comorbidity. Then prognosis. What is prognosis? It is the possibility of the cure of a disease. Is it curable? What is the percentage? How long will it take? So this is called prognosis. Then we'll go to therapy. But I want to tell you the truth. The best therapy you can have for depression is prevention. As it is said, prevention is better than cure. So that is why I want to begin on how you can prevent depression. It's better you don't get depression at all, not to talk about going for therapy. Because many people have lived for depression, even all through their life. All the cases that I've encountered, even all the therapies done on them, they are still doing what is called relapse, falling back into depression. So how can you prevent depression? The first thing you are going to do is avoid toxic people, even their calls, even their connections, even their contacts. Avoid them. Setting boundaries or limits, it does not mean that you're scaring people away from you. Hate them. No, it's for your own good. In your space, you have what I call the three C's: the crowd, the commerce, and the confidence. Go with the confidence in life. In the crowd. Avoid the comrades. They look at your background, but they don't look at about your backup. The other thing that they're going to do, avoid depressive environments or working environments. Then avoid depressive activities or engagements that will pull you down. Things that you don't like doing, avoid them. Don't displease yourself in order to please others. No. Self-love does not mean selfishness. You have to know how to love yourself before you love others. Because Nemo that one don't have it. Nobody gives what he or she does not have. And in life, you don't see problem as a problem. See it as a project. Because if you see it as a problem, it will be a blockage, an obstacle to you. But when you see it as a project, it means that there is a solution in future. Then you do what is called mental detoxification. Life is like a computer that has the hardware and also the software. But the malware will come to attack. Use your antivirus to delete or clean every malware that can be some persons or activities that would like to attack the computer of your life. Then if you are depressed, you have what is called mild depression. You can have a therapy that is called cognitive behavioral therapy. What is it? It's a therapy that works on three things: Cognitive, the way you think, determines the way you act and determines the way you feel. So three of them, they go together. So when you think negatively, you have negative feelings and also you act negatively. So with this cognitive behavioral therapy, we can handle mild depression. But when the depression is moderate or acute or it's severe, you combine two therapies, medical therapy and psychotherapy. Medical therapy. There are some medications that a trained doctor, licensed doctor can give to you. These medications are called antidepressants that will help you. But most time people will doubt the efficacy without the efficacy of this method. Because many people will be addicted to medication. They will say that it only helps in calming down the symptoms and the signs. But actually it doesn't heal depression. That's the opinion of many people. But depression is treatable in a medical way, combined with psychological therapy. Then finally, I have a therapy that I have developed. This therapy is an amalgam from two psychologists. A man called Martin Seligman. He is the father of positive psychology. And another man called Jonathan Haidt. He wrote a beautiful book called The Happiness Hypothesis. So happiness does not lie on that in the outside. It lies in the inside. So this therapy that I will proffer for you if you are depressed is I will create a world of happiness for you. The type of music that you like listening to, listen to those music every day. The type of movies that you like watching, watch those movies every day. The type of delicacies of food that you like eating, eat them every day. The places you like to go, maybe you go to mountain, you go to the stream, you go to the river to see the beauty of nature, do that. The type of books that you like reading, read them. The type of sports or hobby you like doing, maybe you're walking, you're jogging, you're doing exercise, do that. The type of relaxation method that you like, maybe you watch movies, maybe doing relaxation or recreation, do that. And you surround yourself with people that love you and people that you love, people that give you happiness. When you do that, you stay in that world of happiness. After a week, 2 weeks, 3 weeks, 4 weeks, 5 weeks, even a month, you come out from depression. I have used it for many people and it has worked. This is what I call happiness hypothesis method of healing depression. So, depression is treatable if you cooperate with your therapist, the medical professional, and also the clinical psychologist. Thanks for watching this video. In my next video, someone asked me to talk on trauma and post-traumatic stress disorder. You can like this video, you can share this video, you can comment, and also you can subscribe. If you want to contact me for help, you can see my email on the screen, mbonu@yahoo.com, mbonu@gmail.com. God loves you, and so do I.